Welcome to Jones Healthcare. In this series of videos, we provide step-by-step instruction on how to assemble our range of adherence packaging. Today we will review how to manually fill and seal our FlexRx Adherence package. Place the blisters into the assembly tray with the longer top flange directed towards the top of the tray where the pins are located. Fill the blister with medication for each appropriate time pass as indicated on the patient label. When all of the required medication has been loaded, place the cover under the pins at the top of the tray with the print side up. Fold the spine of the cover towards the print side of the cover. Snap the edge ties on either side of the label. The location of the edge ties is indicated on the back side of the label. Locate the perforation above the top row of cavities and fold along this perforation so the top part of the label meets the bottom part of the label. Separate the label into two sections to expose the adhesive. Orient the label with the colored side facing up and the folded edge at the top. Center the label over the blister, aligning the folded edge with the perforation line at the top of the blister. Steady the positioning of the label with one hand, and then use the other hand to fold back the top part of the label toward the tray. Then firmly run your finger over the adhesive area on the label to join the spine of the cover to the top flange of the blister. Fold the label back onto the cover and verify the loaded blister for accuracy. Remove the remaining liner from the label at a 45-degree angle. And, using your hand, gently apply the label to the blister in a downward motion. Using the roller in a horizontal motion, apply firm, consistent pressure over the entire blister and spine of the cover to ensure that a solid seal is achieved across the surface. To remove the completed package from the assembly tray, grasp the edges of the cover at the spine. Peel the medication summary label and affix to the inside cover. Fold over the cover, and the FlexRx is now ready to dispense. Please note, before dispensing, the pharmacist should instruct their patient on the proper use of the FlexRx. The patient can find the appropriate time pass, push through the label with their finger, pinch the label, and peel the label backwards to access the medication.
Before dispensing, ensure the pharmacist has verified the medications for accuracy. Please note that the card is not child-resistant and should be stored out of the reach of children. Thank you for watching. If you have any questions or you're looking to place an order, contact the Jones team today.